I'm here with Immaculate Owomugisha from the International Community of Women Living with HIV and Dr. Carrie Lyons from Johns Hopkins University, and I speak to them about reproductive coercion. Could you explain what reproductive coercion is and what some of the main findings from your study were?
So reproductive coercion is taking a decision over a person's body, mostly the women, without their full consent and without informed consent. And this usually happens when a woman is taking sexual and reproductive health services, including family planning, including choices over when to get pregnant, or if you get pregnant, at what stage should your pregnancy be terminated. And that's when the medical worker makes that decision on behalf of this person, just because they feel you are not in a good state to make your own decision.
Dr. Lyons told me more about the study's findings.
Our study used data from the People Living with HIV Stigma Index study, and we looked at the experiences of women living with HIV across settings and trying to understand their experiences of reproductive coercion by healthcare providers. And what we found was that women living with HIV across settings had recent experiences of reproductive coercion by healthcare providers. And what we found was that women with multiple identities, such as sex work, a history of drug use, or being a migrant, had higher levels of reproductive coercion than women who are not a part of these populations.
Immaculate had some insights to share about what these findings mean for healthcare workers. For such a long time, especially amongst healthcare providers, there have been misperceptions about people living with HIV in terms of whether they can have children, whether they want to have children, whether they should have children. What would you say to some of those healthcare providers?
What I should say to the health workers is what they need to appreciate is that regardless of your HIV status, you still have a right to take decision of your body and your body autonomy. With this concept of body autonomy and integrity, a woman or a person living with HIV should be given a right or a choice to make that decision over their body. We understand our body, we know what we want for our body, and it's not in a good decision or a good concept for a health worker or health provider to make a decision or a choice over my body.